Hi, this is Karen. I'm an international student taking up nursing leadership and management in Seneca College. In this video, I'll be talking about my capstone project about healthcare-associated infection within hospitals in Ontario. The issue of hospital-acquired infection is one of the challenging problems among hospital facilities that greatly impacts the health of admitted patients, healthcare workers, and everyone in the hospital. This problem arises within the hospital premises, leading to a lot of complications such as patients' worsening health status, extending hospital stays requiring patients to undergo more complicated treatments, rejection from the insurance reimbursement causing a ripple effect on the hospital's financial status, and a lot more. So what's the motive of this project? We became nurses because of our caring hearts and healing hands, but these hands are supposed to protect the ill and not spread infection to our patients that can peril their health. You see, when a patient acquired infection while being cared for by healthcare professionals in the hospital, the credibility and the quality of care that are being provided to the patients and the public will be questionable. So it is imperative that the nurses will remain as an instrument not only to provide care, but to prevent harm and illness like hospital-acquired infection to the patient and their loved ones. As for the leadership style, the combination of transformational and participative leadership guarantees a more interactive completion of the goal. Let's face it, with the challenges like this, it is not enough for a leader to sit down and wait for the staff to do what is right, isn't it? Commitment should start from the leaders to encourage the employees to be dedicated, creative, and have a collaborative spirit leading to the success of this project. So, what are the solutions? We all know that one of the major causes of the spread of nosocomial infection is poor hand hygiene. So, for this project solution, it is highly recommended to ensure the incorporation of the Joint Commission's 5 essential plans to improve the hand hygiene, which is the HANDS, or habits, active feedback, no exclusion, data-driven, and the system. For the expected outcome, an overall successful rate on the campaign against nosocomial infection through strict implementation of safe handling and safe touch policy that will increase the rate and enhance the welfare of everyone. However, good plans like this should never stop with just having positive outcomes. Rather, this should be sustained. But how do we sustain this project for 5 years or even longer? How do we maintain good stuff that we have started with when faced with unprecedented challenges in between? It's hard to comprehend at this point, right? Well, in regards with the sustainability plan, aside from hand hygiene practices, leaders can safeguard sustainability by focusing on staff retention, aiming for continuous improvement of the project instead of frequent training of newly hired staff in the facility. Sufficient organizational funding, regular meetings, and assessment of staff compliance can further strengthen the sustainability plan too. Lastly, the compliance with antibiotic stewardship protocol and enhancing the discharge planning and follow-up for patients must be done to secure flawless recovery from the illness. To summarize my report, nosocomial infection is a never-ending battle that not only causes harm to the patient, healthcare providers, and the public, but it also results in budgeting concerns affecting every healthcare institution. We nurses have the power to end this matter by means of being mindful of our habits and strict compliance to the safe handling and safe touch protocol, as well as providing a safe environment to our patients that promote the delivery of utmost level of care from the time of admission up to the discharge phase. This has been my capstone project in NLM 200. Again, this is Karen Lloyd Flores Chua, and thank you for listening. Always remember, your hands are intended to provide care, not to spread germs.